Hi everybody, Dr. Daniel, and today I'm talking about amitriptyline for sleep. Insomnia is a difficult problem, which may be chronic for many people, causing them to lose energy and feel sort of out of sorts. Certain neurological conditions are associated with insomnia. These include migraine, tension-type headache, depression, and generalized anxiety disorder. Amitriptyline for sleep. Amitriptyline is commonly used either short-term or chronically for insomnia. Although there may be side effects, most persons can live with them. In general, the beneficial effects outweigh possible side effects. Since migraine, depression, and pain are commonly found with insomnia, amitriptyline may help with all of these other problems as well, making it possible for the doctor to treat other comorbid conditions of insomnia with a single pill. Also, amitriptyline comes with a large spread of dosages, allowing adequate titration for different persons. It's a very cheap medication, oftentimes can be filled with a pharmacist cheaper than using your insurance policy. Although medium-level drug for insomnia, amitriptyline works for many persons. Although amitriptyline has been around for a long time, it's still a popular, low-cost, generic medication that's commonly used in medicine. It is not addictive, and it's not a benzodiazepine drug like Ambien or Zolpidem, which is a class 4 narcotic and requires monitoring. In general, how does amitriptyline work? Amitriptyline is called a tricyclic antidepressant, and tricyclic means that there are 3 benzene rings in the chemical makeup of the drug. Amitriptyline increases neurotransmitters in the brain, such as serotonin and norepinephrine, which help modulate sleep, pain, and anxiety. How does amitriptyline work to produce sleep? It's not fully understood how amitriptyline helps sleep other than it blocks histamine, which produces drowsiness. Doctors prescribe amitriptyline as a sleep aid, which is an off-label use of the drug, which originally was released by the FDA for treating depression. Off-label use means prescribing a drug for a medical problem that's different than the one originally intended by the FDA. What are the common side effects of amitriptyline? Common side effects of amitriptyline include weight gain, constipation, dry mouth, rarely leading to tooth loss, early morning drowsiness, headache, trouble urinating. Orthostatic blood pressure drop, which means your pressure drops following standing up from sitting, blurred vision. The most frequent side effects, though, are weight gain, constipation, and early morning drowsiness, along with a dry mouth. These usually get better after on medication a month or so. What's the typical dosage prescribed for sleep? The dose of amitriptyline starts at 10 milligrams and goes to 150 milligrams. I like to start with the 10 milligram dose for sleep, which is an extremely small-sized pill and it's very easy to swallow. On recheck in the clinic, that dose could be advanced to 30 or 40, 50 milligrams, at which most persons will sleep well if needed. In general, children and adolescents ages 9 to 13 need lower doses of the medication than older persons. What are the medical indications for amitriptyline listed by the FDA? Indications for the drugs are depression, which was the original indication, neuropathic pain, such as diabetic polyneuropathy, postherpetic neuralgia, migraine headache, and fibromyalgia. How is amitriptyline used for depression? The dose for treating depression in adults is generally 75 to 150 milligrams, starting at the lower dose of 75 and then building up. What are the effective differences in treating depression using an old drug like amitriptyline, which came out in 1961, versus the SSRI group, which started with Prozac in 1990? Both groups of drugs work effectively well for treating depression, and no one has ever shown that the SSRIs are better than amitriptyline. The main difference is that there are usually fewer side effects taking SSRIs versus using amitriptyline. Amitriptyline has a black box warning regarding increased suicidality risk in children, adolescents, young adults with major depressive or psychiatric disorders. How is amitriptyline used for treatment of migraine? For treatment of migraine alone and no other comorbid condition, a starting dose of 10 to 30 milligrams would be helpful for migraine prevention. When you say that amitriptyline is cheap, what do you mean? Some drug plans provide amitriptyline free or for a charge of $2 to $3 for a month's prescription. Can amitriptyline be used for pregnancy and breastfeeding? Caution is advised regarding the use of amitriptyline during the third trimester of pregnancy due to the risk of teratogenicity, which means harming a baby in the womb. It may be used for breastfeeding. Are there certain illnesses that have risk with them from using amitriptyline? Caution is advised for heart disease, liver or kidney problems, glaucoma. Amitriptyline can possibly increase the intraocular pressure. Diabetes, it can cause increased blood sugar. With epilepsy, it can increase the risk of seizures, bipolar disorder, mania, or schizophrenia. What are the drugs that can act with amitriptyline? Monoamine oxidase inhibitors like selegiline, eldeprel can cause seizures or death. Quinidine can cause heart rhythm problems. Opiate narcotics increase drowsiness and raise the risk of serotonin syndrome, which can cause increased blood pressure and elevated heart rate. Epinephrine and norepinephrine can increase blood pressure, headaches, and chest pain. And topiramate can raise the level of amitriptyline, producing possible side effects. But in closing, remember that amitriptyline is a cheap, non-addictive drug that's commonly used, been around a long time, and it's used for insomnia alone. So thank you for listening to this. God bless all you folks who can't sleep well, and I will see you on the next talk.